And welcome back. Well, some people think chiropractors only come to the rescue for back pain, but the truth is they treat the whole person. Here to tell us all about chiropractic care is Dr. Eric Stanenas and Dr. Maria Fenske from ProHealth Chiropractic Center. Thanks for being here, you guys.
Thank you for having us.
Let's talk about that, because I do think a lot of people think that chiropractic is really for just back pain, but you treat the whole person, and that's really what chiropractic is. What reasons do you see people seeking out chiropractic care?
So some of the reasons that we see chiropractic patients are for obviously neck pain, back pain, sciatica, numbness, tingling in the hands, headaches. This time of year, I would say we see people who have injured their back from shoveling, carrying holiday boxes up and down stairs, possibly slipping on the ice and either falling or trying to prevent a fall, and even a simple thing as driving around and unfortunately being hit in a car accident or something. So those are just some of the more common things that we see people for.
Yeah, and I mean, I've sought out chiropractic care for some of those things. I know people in my family, people that you love probably have as well. What are some things that people don't usually think of that people seek chiropractors to help in?
Sure. So as Dr. Fenske mentioned, primarily people think of chiropractors are kind of neck and back doctors. But essentially under the umbrella of chiropractic, any muscles or joints is something that we can treat effectively. Okay, so conditions such as plantar fasciitis, which is pain in the foot, tennis elbow, pain in the elbow, carpal tunnel, tingling in the fingers, shoulder injuries, knee pain, ankle pain are some things that respond very favorably to chiropractic care.
I think you literally just described my whole body. I need a chiropractor. Thank you. So that's fascinating. Okay, so if you're doing those things, what types of services or treatments do you use that treat those kinds of things? Because I think of the typical back stuff, but what are the types of services and treatments that help those ailments?
Sure. So at our office, we offer obviously chiropractic manipulation, which is very gentle, but we also have electric stim for muscle spasm, ultrasound, traction for neck and back issues, and we have a new therapy at our office, which is low-level laser therapy, which works really well for chronic pain. Okay, so individuals that have arthritic conditions, osteoarthritis, rheumatoid arthritis, things that are just very hard to treat and manage, this therapy can be very effective in helping people lower their pain levels.
So low-level laser therapy is what it's called. Does it hurt? Is it hot? Do you feel it?
So it's very, very gentle, okay, and it's a topical application. Works with a photochemical reaction within the body. Most people that have it enjoy it immensely, and really feel the benefit in the first couple of treatments. Well,
I think that's what people want. You know, they want to have relief, and that's why we seek a professional out, because you can't live your best life if you're in pain. You just can't. It's one thing if you've lived with pain, I think so many of us do, you know how debilitating it can be just in fact of your concentration or being able to be present in the way that you interact with people. If you're thinking about how your body hurts, you're just not always there. What's the difference though between, because a lot of things you mentioned confuse me between chiropractic and physical therapy, so how do you differentiate the skills that you have?
So with chiropractic and physical therapy, if you compare a traditional outpatient therapy clinic, there's going to be a lot of overlap, all right? As we mentioned with some of the therapies, ultrasound, electric stim, traction, therapeutic exercises, both physical therapists and chiropractors do. So the main difference is you don't need a chiropractor, or you don't need a referral to see a chiropractor. You do need to see it or have a referral to see a physical therapist.
True.
So to kind of streamline your health care and save time and some money, instead of going to your medical provider, getting a referral to a physical therapist, you go right to your chiropractor, get treatment right away, and start working on some of those musculoskeletal conditions.
Yeah, and I always hear about people, like once you're in alignment, how good you feel. And I remember that too from when I've had chiropractic, that alignment, if you're treating back and neck especially, it's like you feel that instant relief and it lasts, and you have to continue doing it so your body can retrain your muscles.
Sure. Correct. Yeah.
You know, how about, I know you mentioned cost. What about insurance? Because I think a lot of people worry, okay, well, if there's no referral, does that mean my insurance will help me at all?
Yeah, most insurances will cover chiropractic care, including Medicare. And frankly, we like to have our patients feel comfortable at the office with any decision that they make. So we are happy to check your insurance coverage for you and let you know exactly what your out-of-pocket costs would be so that you make an informed, comfortable decision.
I think that's so important when you can have that open conversation, you know, and just say, okay, because I think a lot of people are embarrassed to say, well, I don't know if I can afford this treatment.
Yeah.
But if you just say, you know, how much will this cost, you're willing to take that time and look through that. And you guys do consultations as well.
Correct.
Yep, definitely. And we would definitely, anyone who's interested in chiropractic care or low-level laser therapy, come in for a complimentary consultation. Again, it's just starting with a dialogue and getting some of the basic information. Are you in the right spot? And then we can take the next step if it's something you feel comfortable with.
So the first appointment really should be that complimentary consultation.
Yes.
Versus coming in saying, I want this, this, and this, right?
Yeah, especially if you're new. If you're new to chiropractic, come in and just, you know, get acquainted with the clinic, meet the providers, see if you're in the right spot. If you're, you know, looking for a chiropractor, you're new to town and you're comfortable with chiropractic, you know, come in, schedule, and get the ball rolling right away.
It's true, and you've got a lot of locations, so I'm going to make sure people know where to find you at ProHealth. You can schedule a complimentary consultation with ProHealth Clinic in Mequon or Thiensville with the number on your screen at 262-242-5577 or Random Lake, which is 920-994-2000, and that's where you can find them as well for that complimentary consultation with Dr. Stanenas or Dr. Fenske. Thanks so much for being here, both of you.
Yeah, thanks.
Got to get feeling good before the new year.
That's right.
Appreciate it.